first pediatric clinic, and we're just gonna kind of go over some things for medication administration.
Next slide.
These are the training objects. I'm not gonna kind of read it word for word, you guys can read, I'll just kind of go over some of the. So we'll just go over what is medication, what is needed for safe and effective medication administration, how to administer the medication, emergency medications, and then how to document. So a medication includes anything, including over-the-counter medication. So it will come in with a label on it. So everything has to have the child's name, you know, what it's for, how often it's given, and the doctor has to prescribe it. So it usually comes from the pharmacy. And those things can be prescribed for up to 12 months, so everything should be good for about a year. It also tells you about medication cannot be mixed with liquids or food unless the doctor says to mix it. It has to be stored in a secure place that nobody can get to, the kids can't get to it. And of course, we must check the expiration date on everything. Even if it says it's good for a year, you know, you can give this for a year, then check the expiration date. Sometimes they give things, you know, that run out. So always make sure you check the expiration date. And then it says, whenever possible, use the same personnel to administer the medication. The reason they do that is just so the kids get, you know, you guys get used to it, and so do the kids. But the other thing is, try not to get complacent with that. Just because you're the one that gives it to them all the time, you know, always still check. You know, you always have to check everything, because things could change. And of course, it says immediately advise the parent if any adverse reactions, such as diarrhea, skin rash, temperature, or if they refuse to take the medication. And first and foremost, if there's any errors in administration of the medication, please let somebody know, the parent, guardian, medical provider, because, you know, kids could have the same first name, you just don't know. You could just give someone the wrong thing, or you might give them just the wrong amount, or whatever, so just please make sure you keep that in mind. So, oral medication, like tablets, capsules, or liquids, should be given with at least 4 to 6 ounces of water or other liquid so they can swallow it easily. Topical medications, which includes eye drops or ointments, ear drops, creams, anything that you have to apply to the skin. Make sure that you wear gloves and wash your hands before and after. Inhalers, nebulizers, which could be either nasal or metered dose, like an inhaler or the nebulizer. The nasal goes right into the nares. The meter dose is the inhaler, and it says always use a spacer. So depending on the age and size of the child, you could either use this kind of spacer, which how you do this one is, of course, this would be on here. You take this off, shake, put it on here. The child puts this in their mouth. One squirt, they inhale a couple inhales. Then you shake it again, another squirt, and they inhale the rest. This one and this one, and there's different sizes for different size children, the masks. These have to be washed weekly. You just take them apart, they come apart, and you soak them in warm water and let them air dry. Never wipe the inside of these after you clean them, because they have a special coating on the inside that are, it's designed to help the medicine go through. So you just soak them and let them air dry. And nebulizer, that goes, I don't have a nebulizer thing. Do you guys have nebulizers there?
We require the children to bring their own.
Okay, good. So they have all the equipment for it and stuff. Okay, I don't have the nebulizer here, but it is metered doses that you put into the thing. EpiPen is an injectable medication, which is epinephrine, and it's prescribed for treating allergic reactions. Any child that has an allergy will get an EpiPen. Some of them look like this, some of them are a little bit different color. They're basically all the same. The pharmacy on base only uses EpiPen Junior. So they'll all look the same. It basically tells you exactly what to do. You can read it right on the thing, but because there's other ones, there is one that talks, but like pharmacy on base does not use the one that talks you through it. This one has the whole directions right on it. Even if you're in a panic, you can still read it real quick. The new thing, it used to tell us to hold, once you put it in, you hold it for 10 seconds. Dr. Adams says that now the new thing is 3 seconds. You just only have to hold it in there for 3 seconds. So any of them, even the one that talks to you, it's 3 seconds. It's not 10 seconds anymore. So handling medication, which is the next slide.
Sorry.
It's okay. Before administering any medication, always wash your hands. If the student will touch the medication, he or she should also wash their hands. Use soap and water, or if that's not available, you can use hand sanitizer. However, if they're visibly soiled, you have to use soap and water. Avoid touching the medication. Some medication can come through your skin. And never cut or crush any tablets or anything unless it's written on the box, like it says crush and put in applesauce or whatever it would say. For liquid medicine, always use either a syringe, a dropper, or one of those little cups. And you have to keep the cup on a level solid ground so you can make sure that you're pouring the correct amount. Because those are a little, a syringe is a little easier, you can see the marking and can tell you kind of exactly how much you're getting. So this is just accurate administration, just to safely manage and administer medications with the 7 rights of medication administration, and they must be followed each time. That's why I said just because you're the same one that gives it all the time, make sure you still follow these rights. Right patient, right medication, right dose, right route, right time, and right documentation, and right to know. Medications include albuterol for asthma flare-ups, EpiPens for anaphylaxis, Diastat for seizures, Glucagon for diabetic emergencies. And like I said, all of those medications will have all the instructions on the label. Also, children that have asthma or even like diabetes, all those things, they will have an action plan, especially asthma. The pediatrician usually fills that out, and a copy stays with them and a copy goes to wherever they go, school, daycare, wherever. And the medication and the plans should always be provided prior to the patient starting at the daycare. And they have to be within 12 months, and they have to include details about triggers, signs of distress, and medication instructions. The Air Force 1055 will be initiated by the parent annually to authorize administration of emergency medicines, and there's a copy of it in these, on here, but anyway, and it's right here. And it's kind of pretty straightforward, it's just, let's just fill that out and, like I said, it says again, if any emergency meds are needed or used, you have to make sure the parents know that you've done it. So, epinephrine for anaphylaxis, that's a life-threatening allergic reaction. And it can be from food, it can be insects, medications, latex, or even exercise, because people can have exercise-induced asthma, so. Symptoms of anaphylaxis include itching, hives, difficulty breathing, increased heart rate, which you guys wouldn't know if they had increased heart rate. You would just know about you know, they said, you know, they keep coughing or say they can't breathe, things like that. Nausea and vomiting can also be one of them, or even if they collapse. So definitely students with severe allergies should have an allergy anaphylaxis emergency plan. Once anaphylaxis starts, the treatment may be immediate injection of epi, which is you would go get the EpiPen, and it's effective for only 10 to 15 minutes. Within that time, you guys will be calling 911. So hopefully they will get there within 10 to 15 minutes. Although epi can be used twice, we only recommend you guys do it once and making sure you call 911 as soon as you're doing it. And remember, epi, I'm sorry.
Can I ask a question? I know that you said that they advise that we only use the EpiPen once. However, those boxes here come with 2 in them. If we are on the phone with 911 and they advise us to issue the second one, we
Yes.
should. And
Yes.
that is also why parents are required to have that box with both EpiPens in it, correct?
Yes, ma'am, but here's the other thing. Right now, the pharmacy has a shortage, so they're telling parents to split the dose. Keep one at home and one goes to daycare.
How would you advise us, given the fact that the box for the EpiPen does say that the quantity should be, how should we advise them to ask for a label?
The parent can go to the pharmacy and ask for a different label. The pharmacy will give,
Advise that on the unit, or would that be on the box, considering the
Um,
box is what has
they
the
can probably put it on the box, because you guys gotta keep it in the box. You can't take it out of the box, because it's not gonna be labeled. They can put it right on the box. The pharmacy does understand that some kids either go to school, daycare, or whatever, and they have to do that. I mean, they're trying to keep it where it has 2 in it, but with the shortage, and kids who have severe allergies, they have to separate them, because otherwise they wouldn't have one at home. So,
Thank you.
you're welcome. And that was from Dr. Adams. She told me that yesterday, because I even asked her, I said, oh, it comes with 2, right, in the box and stay there? She said, no, they're telling them to separate it because of the shortage. So that's why I'm letting you know what she let me know. And remember, the EpiPen, it's not, you do not have to remove the student's clothing. It goes right through their clothes. Remember, if you're using it, identify straight away. Call 911. Tell someone to call 911. This really just tells you, oh, not that one. The next one. Oh, that's okay. This kind of just tells you basically what I was telling you about the EpiPen, how you have to remove the cap, and it tells, see that says 10 seconds? No, Dr. Adams yesterday said 3 seconds. It's 3 seconds, then of course you remove it and dispose it in the sharps container. Glucagon is another emergency medicine for, oh yes,
The insert of EpiPen is always through the leg, it's not like it's just gave the child, it wasn't a doctor.
it's usually always just right in the leg. Adult, child, whoever, whatever it is. And that's also so people can give it to themselves. You know, it's easier for someone to do this than to try to do it in their arm or, you know, somewhere else. It's just right in their leg. You're welcome. So this is another emergency medication. It's used to treat severe hypoglycemia, which is low blood sugar in a diabetic patient, and patients who are treated with insulin who may have passed out or cannot take some form of sugar. Most of the time they just tell you to give them something sugary and it will bring their blood sugar up. But if they're unconscious, then you use the glucagon. And each, also, again, I tell you, everything has instructions on it, because you're not gonna remember in an emergency. You know, you're gonna be like, oh, what do I do? But each thing has it. So it's gonna tell you to flip off the seal, remove the needle, cover the syringe, and then go through the rubber stopper and take the entire contents, you know, swish it around. So you just have to do exactly what it tells you to do on here. I've never had to use glucagon before. You guys have a lot of diabetics where they have this order? I've never had to use it either. And it kind of tells you the same thing, except for you do it to remove the clothing, and you have to clean the area with alcohol. And of course, if you're using this, the first thing you're also doing is calling 911. The next thing is just talks about the Air Force Form 1055. And of course, that has to be completed with all information has to be filled out before it can be accepted and administered at the youth center. It's a legal document. It has to be written legibly with black or blue ink. For recording errors, do not cross out with a single line and make corrections in initial. Do not use whiteout. You can't use whiteout on any medical anything, nothing. And the parent or guardian must initial each day and section titled. So I'm sure you guys already know that. You have the forms there, you write on it and they have to initial it. And if it's not given, you have to write why. And this is just a copy of the Air Force 1055 that you guys use. That's okay. So it just tells you the medication, the purpose, expiration date. So each day that you're using this, you're checking. So, alrighty. So the next thing is concussions. A mild traumatic brain injury, which is what TBI stands for, is caused by a fall, getting hit directly, and it can have either positive or no loss of consciousness. Symptoms include physical headache, dizziness, vomiting. They're not themselves. Like a little kid, you can't say difficulty concentrating or mentally foggy because you won't know what that means. You'll just know hey, they're not acting right. You know, they fell and hit their head, but they're kind of acting funny. Emotional or irritable, feeling more, like crying more, or if they want to go to sleep straight after, even if it's their nap time, do not let them go straight to sleep because you have to kind of keep them aroused. So if they have a head injury and they want to sleep more or whatever, that's a sign of, where it could be a little worse. So when I was talking to Dr. Adams yesterday, she just said, if they hit their head, most likely you guys are going to call the parent, the parent's going to come, but just whatever you do, just try not to let them go straight to sleep, even if it's their nap time. Not that they can't go to sleep, but they have to be easily aroused, and you guys wouldn't know that or not, So she says the best thing is just not to let them go straight to sleep. And just keep an eye on them, make sure they're acting right, not vomiting or anything like that. Sometimes they base a concussion on just the physical symptoms or the symptoms that they see that the child is going through. They don't always have to do it. Yes, ma'am.
Sorry, I have a question. Is there like a time limit on like the sleepiness thing? Like, is it like after like an hour they're safe? And when are they safe to sleep?
I don't know the exact time limit, but just if they were, like if you saw them really hit their head, you were probably gonna call their parent anyway, so within the hour they're probably gonna be there. But we kind of look for, like I said, if they immediately wanna fall asleep, that's just not a good thing. But we just look at like, are they walking straight now? Are they, wanting to sit, or are they kind of like, just not acting themselves? I mean, then you definitely shouldn't let them go to sleep, no matter what the time limit is. But of course, like I said, the parent would probably be there by then. But if you just notice they hit their head on the swing set pole or something, just kind of watch them, and then say an hour later is nap time. I'm sure that you can let them go to sleep and then just make sure they're easily arousable and things like that. But if you really see them hit their head, you're going to call their parents, and they're probably going to end up taking them to the ER anyhow. So, treatments of concussions, they depend on the severity of the injury and other abnormal findings. Like I said, if they're not acting right, if they are walking kind of funny, or they're just not themselves, you would kind of know. Or if they start vomiting, that's a big one. Most of the time, if you were to send them home, and even if they, or the parent came and got them and they just said the doctor said, oh, they're fine, they should have at least 24 hours of like rest, no hard playing, no, I mean, they can still do normal things, but you would want to watch them. They wouldn't want to be, say, running a marathon or, things like that. Just kind of keep them less active than normal, you know, most of the time. And if they do have a concussion, it doesn't mean they always have to be in the hospital, but they'll say, you know, no roughhousing, no playing out on the playground, or whatever the case may be. They'll all have instructions, and sometimes parents probably keep them home for a couple days anyway. But this here, it just tells you what things that you should, you know, do as they return to play after a head injury. And see, it does say there, an initial period of 24 to 48 hours of both relative physical rest and cognitive rest. But these guys are so little, they don't really have cognitive, you know, rest per se, because they're not really doing much of, you know, unless they were in school. And here it is, says cognitive rest is just important as physical rest. They can read, do video games, but see, that says it can make the symptoms worse. That's why, what they mean by cognitive rest. But the real little guys aren't going to be doing that stuff. They usually get 1 to 2 days off of school. And these things are for a concussion that was diagnosed. You know, they'll take off school, they'll have increased time to do things at school, things like that, until they can tolerate, you know, the 30 to 45 minutes of concentration without like feeling nauseous, feeling tired, feeling, you know, anything like that. This next one is for basically school-aged kids. It just tells them the different signs or symptoms that they could have with a concussion: headache, dizziness, visual symptoms, noise sensitivity, difficulty concentrating, or even sleep disturbances. They'll either sleep more or sleep less because they're, you know, their brain's trying to heal. For medications for concussion, Tylenol or Motrin, Zofran for nausea, melatonin for sleep disturbances. You guys wouldn't be given any of the, like, melatonin, but maybe Zofran or Tylenol or Motrin. But of course, like I said, you have to have the doctor's order and everything. And the goal is to prevent a second head injury in the short period of time. That's why they want the physical rest, because if they're just not up and themselves, they still kind of be off a little bit, their balance might be off, you know. We don't want them fall and hit their head again, because, you know, that's dangerous, of course. If they have symptoms after 4 weeks, you know, they probably would have to go back to the doctor to have more tests and things like that done. Kids who do hit their head a lot, there are helmets that they can wear, or kids that have seizures, which would cause them to bump their head or be able to fall out, they do have helmets. I don't know if you guys have anybody that wears any of those helmets or anything, but that's kind of what that is for. It's not someone just that falls and gets a concussion would wear a helmet. It's things that they would know that, that they could do it again. And so we have to just make sure you remember the 7 rights, how and when to use the emergency medications, the Air Force Form 1055, and concussions. Now, does anybody have any questions, or can anybody tell me the 7 rights? Or one of the rights?
Right medication, right child, right name, right dosage.
Right route, right time, right route.
Yeah.
Wow.
child.
Yeah, and the right to know, and that's really for older kids, and this just means they get to know why they're taking medication. Or make sure you know why they're taking medication. You don't wanna give somebody medication that you have no idea what it's for. So, if you know that you're gonna be given a medication that you've never used before, try to look it up, or Dr. Adams comes over to the CDC every day, so you can always ask her, hey, we have this new kid that's taking this medication. Do you know, what is this for? And what kind of possible side effects would we look for? You know, because, you know, that way you'll know what kind of side effects that you're gonna be looking for, or anything like that. Does anybody have any questions?